Yeah. Start getting your baby ready. After 34 weeks, you can encourage your baby to get into the right position for birth. If the baby is in the breech position, there are exercises to turn the baby head down. So you have to do those exercises and try regularly kneeling on the floor over a birthing ball, or if you don't have one, use a chair because gravity is always helpful even during the labor. So these are the optimal fetal positioning, like resting over a beanbag, sofa, or you can go ahead with a birthing ball. Again, you can just rest your chest onto that, not placing complete the belly onto the beanbag, just placing only the chest. You're just relaxing your chest onto the ball or the bean. Rock on all fours. This exercises I'll show you in yoga, so I'll just skip right now. And sit backward on chair, Japanese sitting, which is vajrasan. That's really good. If you have any, like whenever you eat, you get the regurgitation again, you will feel the nausea, you can straight away sit on the knees. So I'll show that position as well, so which will be helping you for the easy digestion. Like, don't immediately walk after you eat, just give a 15-20 minutes break, then you can go ahead with walking. Give a gap because it has to get a weight down there. If you're walking immediately, then you will feel the food is coming out. Okay. Then this is standing, lean forward, and rock. These are the fetal positioning, and I'll show you more, which is Shakti Bandha in yoga. It will also help you into get to the baby's head down position.
Yeah, so I would just like to add on this from an obstetrician's point of view that what is optimal fetal positioning. So basically, there is a thing which is called as a fetal presentation. So that is how the baby is lying inside your womb. So there is one presentation is called as a cephalic, which in a common term is known as a head down. That means the head is towards the cervix. So the other position is called as a breech position, which is known as a bottom down, in which the head is towards the fundus of the uterus and the buttocks are towards the cervix. So that is not at all a favorable position for the delivery. And whenever you have a baby, you need to have a cesarean section for that. But head down is the most favorable position for all of us. So over to you, Revati.
Yeah. Know how to squat. Squatting is something which is really important where you are taking help with the gravity. Now, when you are doing in an improper position, it might strain your muscles and your muscles get more tight. So, and it's not giving a good squat as well. So, squatting opens the pelvis and helps the baby get into the ideal birthing position, like head down, face towards back, chin tucked in. Open a door, hold on to the doorknobs on either side, and drop into a squat for 1 or 2 minutes. With your knees wide apart, pull yourself back up using the doorknobs. Or you can take a birthing ball, place it on the wall, and just stand and take the ball behind, and you can squat with the help of the wall support. So this will help you even in a proper squatting. You don't feel the strain when you squat. So squat walking is the other one, which you can start from the third trimester itself. You need to squat coming up. I'll show you the exercise as well. You need to squat coming up and going for a squat. So this is completely making one round in the room.
So you,
So this will helpful in the labor as well. Yeah, the next slide.
so can okay.
So keep a watch on your postures. Keep your body aligned so that baby can glide smoothly, standing and sitting for extended periods, sleeping in awkward position, and wearing high heels and tight belts could misalign your body. So sit with proper support to your back. There would be added pressure on your spine during pregnancy, and mishandling your body can only increase the pain. Sit with folded and stretched out legs, as hanging them too long can lead to swelling. Do not slouch when sitting or bending to lift things. Do not rush down or up the stairs. So always keeping the posture. I have the images, like if you're sitting, how exactly you have to position your body in sitting. And if you're lifting the objects, don't abruptly like slouch forward and get onto the objects. No, you should always kneel onto your, you should go for the kneeling first, then pick up the object. And coming to the lunge position, semi lunge, you have to come little bit up and then lift the object completely up. Don't strain more on your pelvis, which will be weak during this time. So you should always lift the objects in a very proper way. Any questions in the slides? I'm ready to help you out. Any questions? Because lifting objects is really important in day-to-day living. Definitely, 2 to 3 times we will bend down. So any improper position also will give a lot effect on over the low back. So you should really maintain a good posture even during lifting the objects. Now, this is if you observe the slide here, this is the incorrect standing where you can see the chest thrust upward, like it's completely up. You're leaning more behind and hips coming to the forward and glutes clenched, like you're just tightening your buttocks to maintain that position and weight in balls of the feet. Like you'll take more pressure over your feet. You should never do in this position because it again gives you the low back pain. You should always maintain in the stereo way. Like you have to make sure your ribs are down. Always relax your ribs. Don't always lift this up. Relax your ribs down. Shoulder over the hips. Like shoulder should be straight to the hips. If you see in the image, you can see the shoulder and you can see the hips. It's straightly aligned. And always hips should be back, glutes relaxed. Always make sure your buttocks are relaxed. It's a immediate effect. Like if anything, if you wanted, like if you had a slip or a fall, you will immediately tighten the glutes. That is what you should never do anytime in the standing position. So you should always maintain your buttocks to relax. That is when there won't be any tightness around the pelvis area, means the hip muscles. This may go into tightness. Always make sure you're in the standing in a correct posture. And while sitting, slouching is the best way. As women feel, like mothers feel, slouching is really good, I can relax well, but no. And leaning back is also no, because if you lean back, what happens, you might feel more the pressure over the low back. So you it intense go with the low back pain and the tightness over this area. So you have to maintain your position in straightly aligned. You can place a pillow will be helpful if you're sitting on the sofa or you're sitting on a chair. Make sure your spine is straight and not sitting for too long. If you're extending, like if you're sitting for more than 30 minutes, definitely it will create a tightness over the behind, and you won't feel like while walking you'll know it. Like you'll feel, oh, I'm not able to walk more and all. So you have to maintain your posture well, like place a pillow till the tailbone, as I said earlier, then resting your back. So this is the best way you can be in a sitting. If you feel like if you are in a movie theater, just go for one walk and come back and sit again, but not extending your sitting position completely. And standing as well. Don't stand for more than 20 minutes. Shift your weight to the right side for some time, like stand completely over the right leg and again shift your body to the left side. So always make sure you're balancing well during the standing position as well. So don't entirely take the weight on two legs at a time. Any questions in this? So this is a position where if you're even during the exercise phase, if you're suddenly like abruptly coming forward and just getting up, no, never to do. Always go with the side. So whenever you're getting onto the bed, like sit, just lie down to the side, take your legs up, and then get into straight position. Never go directly to the straight position. So you can see in first slide, I mean the image where the mother is sitting, then slowly she's sliding to the side and getting her legs up and getting into the side position. And even supine position, no. After the second trimester, try avoid being more in the supine, like straight position, because definitely there won't be good oxygen supply to the baby. If you lie down to the left side or to the right side is the best position. Never go on prone, never to sleep on your belly.
Yeah, so I just want to add on a point in this. So it is always recommended that after 28 weeks, it is better to sleep on your left lateral, or whenever you lie down, sleep on your left side. So this is because there is a, blood vessels like inferior vena cava, which is if you lie on the back, then that gets compressed. But if you lie on the left lateral, then that is relieved. Basically, that compression is relieved. So that is why we all recommend to sleep on the left lateral for so that the optimal blood supply is going to your baby as well. So this.
So in yep. In first few weeks, you can place the pillow under your ankle or under the knees. And after later weeks, you should always get into the side one pillow under your head and the other two pillows. If you want, if you're comfortable with two pillows, you can place it between the thigh to the ankle. You can stretch it this way as shown in the image, because this is a really comfortable, and blood circulation will be happening when you're sleeping in the side position. And always make sure your feet are elevated. It should not be like placing one thigh on the other thigh. Try to place a pillow in between. That is a helpful way for the good circulation. And even you don't feel the calf strain during the night, like a cramp in the calf. The next slide.
So, eating healthy and staying healthy is also very important. So, you should have a healthy diet during your pregnancy. And there are many myths around diet, Indian diet in pregnancy as well. So, what I would say is everything in moderation is fine, but it should not, exceed like you are taking unhealthy diet. That is not recommended because it all starts in the womb. If you are eating healthy, that will help to prevent diseases in newborn as well as that when that newborn grows into an adult. So if you can search yourself on the internet as well, there is a hypothesis which is known as a Baker's hypothesis, and this is what I suggest all the time. What it says is that whatever you eat during your pregnancy and during your preconceptional period, if you eat healthy, that there is a proven evidence that all the childhood diseases like asthma, heart disease are less in the babies, as well as when they grow into adults, then there is a decreased risk of having high blood pressures, certain cancers. So having a healthy diet during pregnancy is very, very important, and having a good amount of diet. It is not like eating for two is also a misnomer. You need not to eat for two. You just need to add on few extra calories during your pregnancy, and your weight should not be overweight as well. It should be an optimal weight. Now, how we calculate the optimal weight, it depends upon your BMI. So BMI is basically a weight to height ratio. So suppose your BMI comes out to be 18 or 20, then you need to gain around 15 kgs during your whole pregnancy. But 18 to 20 to 25 is the normal BMI. If you fall in this category, then you need to gain around 11 to 12 kg in your whole pregnancy. And what we recommend, like what all the guidelines says, that most of the weight gain happens after 20 weeks. So if you see after 20 weeks, it should be like 1.5 to 1 kg weight gain in a week. That will result in gaining around 11 kgs. Because if you are overweight, that will also increase the pregnancy related complications, and underweight will also increase. So the optimal weight is very important during your pregnancy, and eating healthy is the most important thing. So in eating healthy comes you should take plenty of fruits, vegetables, then roti, chapati, high fiber diet, and avoid junk food as much as possible. Once in a while is fine, but not all the time. So any questions till now? Okay, so we will move on with the next one. So over to you, Revti.
If you're starting an exercise routine, make sure you're doing any prenatal yoga, walking every day. You should walk like once in a day. And flexibility, especially in your hips, will help you when it comes time to push. Exercise will also prevent you from gaining too much of weight. So always make sure you're exercising once in a day. That's absolutely fine. And main thing over here, whenever you wanted to start an exercise, never to do it on empty stomach. Make sure you're having any apple or any fruit, so any dry fruits, whatever you like. A milk also is good. And after that, you wait for 45 minutes, then do the exercise. If you have heavy meal, wait for 2 hours, not immediately do any of the exercises. And make sure you're doing exercises before evening 7 p.m. Okay, make sure of it. And from morning 6 to evening 7 p.m. is all good. Anytime you can do the exercise. And don't do a combination like walking and exercise together. Make sure if you're exercising in the morning, make sure you're walking in the evening. But if you are preparing for the labor, so there are exercises to induce labor. So you have to do it in a way like 2 to 3 times exercise in a day, as well as walking, stair climbing. There is a myth that don't go stairs. Yes, but not at a stretch. Like you have to go 5 stairs and come back down and again go with the 5 stairs. It's a exercise and it really helps in the labor to process well. Okay, it's a very good exercise as gravity is helping to push the baby down. So it is a very helpful one. Stairs, you can do that.